Welcome back to Good Day. All right, we are still in the middle of a pandemic, and a lot of people are still trying to get back to their normal lives, including having children. So we've got an OB-GYN with us this morning, Dr. Keisha Gaither, to talk to us about being pregnant during the pandemic. There's going to be a lot of questions that people are having right now. Specifically, Dr. Gaither, is it safe to have a baby in a hospital, or is it safer to have one at home?
Well, you're speaking to a maternal fetal medicine specialist, a high-risk specialist, so you know I'm going to say you need to come to the hospital. Now, I personally think that it's safer to have a baby in the hospital. Keep in mind, now that the pandemic has come, there are a lot of things that have changed.
Sure.
Certainly, every OB-GYN across the country has structured, seen patients in a staggered manner, such that there's not a lot of people in the waiting room. There's certain guidelines as to who can and who cannot come in and when they can come in. And certainly there is 6 feet distance, there's mask wearing, there's PPE wearing. So from that vantage point, it's relatively safe for expectant mommies to come in, particularly if they have high-risk issues.
Right. Well, let's talk about some of the specifics. For example, keeping those scheduled appointments, because again, a lot of people are using telemedicine right now so that they don't physically have to go into the hospital. But with pregnancy, it's probably a little different.
It is very different. I would think that, if you're earlier on in pregnancy, then perhaps televisits might be an option. But certainly as you get further along in gestation, in the late second and particularly the third trimesters of pregnancy, you need to see a physician so they can actually eyeball you and lay hands on you and check and everything else like that. And most definitely, if you're high risk, you need to come in.
Absolutely. Another thing for improving positive outcomes with pregnancies would be vitamin D. And you specifically mentioned vitamin D testing and supplementation.
Absolutely. Vitamin D is a very important micronutrient that's important for a whole host of things, but particularly in pregnancy. It's important for fetal bone formation. It has been shown to decrease your incidence of preterm labor if you are, in a therapeutic range. And certainly in the time of COVID, vitamin D is very important in boosting your immunity. And this is particularly relevant for people of color. Vitamin D is made in the skin in conjunction with sunlight, but melanin inhibits it. So it's really important for women of color to have their vitamin D levels checked. You can either have your physician check it, or there's a great website called powerofd.org where you can not only learn about various nutrients that are important during pregnancy, but certainly in vitamin D, get a test kit, and so forth and so on. You want to have a level of 40 to 60 nanograms per milliliter, and you want to keep that in check, particularly during the time of COVID.
Dr. Gaither, can we talk about diabetes? Because I know that personally, I have several girlfriends who got gestational diabetes while they were pregnant, or if you are diabetic before becoming pregnant. These are all issues that also require you to stay on your medications.
Absolutely. COVID is a nasty little player, but it particularly attacks those people who are diabetic and poorly controlled. So in pregnancy, you already have 2 strikes. Your immune system is depressed simply because your body is smart. It depresses your immune system to allow the fetus, which is seen as a foreign object, to grow, thrive within your body. And then the second thing, you have diabetes that's poorly controlled. You're a bullseye for COVID. And most of the poor outcomes that I've had since this pandemic has been primarily with women who are poorly controlled diabetics. So if nothing is gained from this discussion, if you're diabetic, it's important for you to get in control and stay in control and be compliant with your meds.
All right. Dr. Gaither, you are a wonderful wealth of knowledge. How can people get in touch with you and find you on social media?
Well, I'm certainly on Twitter at Keisha Gaither MD. I have a website, www.keishagaither.com. I'm here at New York City Health and Hospitals, Lincoln and the Bronx. You can always, if you're in the area, just drop on by.
Shout out to the Bronx. Thank you, Dr. Gaither. Appreciate your time this morning.
Thank you. Have a good day.
All right. You likewise. Cody, back over to you.